having that space to share our knowledge, our experience performing research will be absolutely necessary. So this is the biggest meeting in the world to change and to try to foster the MS nursing position in the team.
One of the things that tells me is that I need to use my listening skills. I really need to focus on my patients, not be so concerned about what I have to offer them, but I need to listen to them to hear what they need from me.
We have demonstrated that this program is useful to increase the activation of the patient, so they know how to be responsible of their care, they know how to knock at our door, and they know how to engage with all the system.
We are now initiating our own research, nursing research into nursing issues that are of importance to our people with MS.
You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. At every stage of the MS journey, nurses play a critical role, from diagnosis and treatment to long-term care and support. They are often the constant link between families, patients, and the wider healthcare team, helping to translate complex information into everyday understanding and guidance. At ECTRIMS 2025, the importance of MS nurses was highlighted with 2 dedicated sessions focusing on shared decision-making, health literacy, and patient engagement. These sessions underscore just how central nurses are in empowering people with MS to take an active role in their care, but also how they continue to evolve and adapt their delivery of clinical care. In today's episode, with my guests Amy and Miguel, both specialist neurology nurses with extensive experience in the field, we'll explore their impact, their expertise, and the difference they make in the lives of people living with MS. Amy, Miguel, thanks for joining me.
Thank you.
Thank you so much.
So I think it seems like a logical position to start the conversation around having nurses sessions at ECTRIMS is a relatively recent addition, obviously a hugely important addition to the program. I'd love to hear from both of you why you think it is so critical that we do now have these sessions included as part of the ECTRIMS program.
I think it's extremely important to have the nurses' sessions included at this program. I've been attending ECTRIMS for many, many years and have always enjoyed learning from our physician colleagues. And a couple of years ago, we were offered the opportunity to have one nurses' session, and it was overwhelmingly popular with the nurses who attend worldwide. Gives us an opportunity to meet colleagues from all over the world if we haven't met them previously, and to hear from other nurses about nursing-related issues, which in many respects are certainly MS-related, related to NMOSD and MOGAD more so now as time goes on, but with a little bit of a different twist, with a bit of a nursing focus to it. And I have been extremely pleased that in last year and this year we've been offered 2 sessions because of the original popularity. And I think that just continues to grow, as evidenced by our great attendance yesterday.
I think that one of the best strengths of our nurses sessions is the opportunity to link with nurses with a high seniority and one with a huge experience on the field with the new ones. So in the next maybe 5 and 10 years, we will have a shortage of nurses, so a lot of new ones will join the MS community. So having that space to share our knowledge, our experience performing research will be absolutely necessary. So this is the biggest meeting in the world to change and to try to foster the MS nursing position in the team. So thanks to the ECTRIMS for providing us that kind of opportunity and meetings.
Yeah. Yes, you're absolutely right, Miguel. The role of nursing in the care of people with MS and their families is increasing. No longer are we just a small part of a research team. In many respects, as Miguel can attest, we are now initiating our own research, nursing research into nursing issues that are of importance to our people with MS.
I think we've seen, there have been a few reports published recently highlighting how critically important nurses are to the care of people living with MS. There's been studies that have shown the long-term impacts and outcomes for people living with MS that have access to a specialised MS nurse are better than those that don't. So I don't think anyone can underestimate the role nurses play in the treatment and care of people living with MS. There's obviously a really strong nursing community that attends the conference, and it's great that they're in the sessions. How important is it as well that it's also an opportunity for neurologists to sit in those sessions as well and really start to understand how important nurses are and to hear these conversations and for them also to be included in that process?
I think that's one of the key points. At the very first sessions of the nurses at ECTRIMS, they were only ideated for nurses, but now it's for nurses and allies. And that's one of the other strengths of our session. So we want to work in a multidisciplinary team. We want to share our knowledge, and we want to perform an holistic research, including all the stakeholders and all the members of this multidisciplinary team. So I think it's important to continue with that kind of sessions and including also patients in our session. This was the second time in the nurses sessions that we have a person with MS sharing its experience taking part in research. So I think that will be the future, including the other members of the multidisciplinary team and including the other part of the MS community, people with MS.
Mm-hmm. I also think and thank the ECTRIMS organizers for including a nursing session in the actual ECTRIMS sessions. Previous to our first session a couple of years ago, the nurses had a pre-day on their own, but to include it as part of the overall ECTRIMS program is important because we are seeing more and more neurologists, particularly the young neurologists, the ones in training, who are there to identify what the role of an MS nurse is, what does it look like, because many of them are thinking about building their practices as they move on in the future, and they're thinking about the role of the nurse who can participate as a vital member of the comprehensive care team for people with MS.
Well, and I think the role of the MS nurse is something that's evolved hugely over the past little while. Essentially now the way I look at it a little bit is you're the hub and the spokes that come off it, because there's not a stage of a person's journey with MS that nurses aren't involved, from diagnosis, treatment decisions, family planning, acceptance, all of these things, lifestyle modifications. Nurses are central to all of that and having those discussions. Patients we hear regularly, my nurse is the one that I talk to about all of these things. Can you just, I think it's amazing how that role has really evolved, and now we have such a greater, respect is not the right word, but a greater understanding of exactly how critical nurses are. How have you seen the roles change? You've obviously been involved in this for a while.
One of the things that I am looking forward to today and tomorrow as well is attending the sessions on aging, because increasingly my role as a nurse is helping my patients navigate aging. What does aging look like in the context of MS? And there are sessions here about aging and rehabilitation and expectations. So I think the role of the nurse has expanded tremendously. And as you say, there isn't a part of the patient's journey that isn't touched by MS nurses. So I attend these meetings to learn about other things that I can bring back to my patients to be a better part of a comprehensive care team.
And also we have numbers to support that the role of the nurse is increasing the patient-reported outcomes and the patient-reported experience. If you see at the latest Cochrane revision about the information provision, it says clearly that when you have a nurse involved in the treatment and management of a patient, the outcomes are increasing, the information is well received. We are translators most of our time of that kind of information, but also, as Amy said, we are helping our patients to navigate through all the process, from the beginning of diagnosis until the healthy aging, as you said. So we have the kind of figures and numbers. We need to foster that role in order to increase all the time these health outcomes.
So let's talk about the nurses sessions that happened at ECTRIMS 2025. Some really interesting topics: shared decision-making, health literacy, patient engagement. I think it was a fascinating program that was put together. I'd love to hear your highlights from those sessions. Probably hard to narrow it down too much, but love to hear some of the ones that you were particularly interested in.
This year I have a dual role. So I was chair of one of the sessions and I was a speaker in the other one. So it's quite exciting having that different phases of the sessions. As a speaker, it was amazing. We had the opportunity to share an example of research that tries to impact and to increase how the patient is managing with its condition. It's a program, the Expert Patient Program of Catalonia, that tries to train a patient with a long experience in managing the disease and to foster his skills in order to lead some sessions with other people with the same condition in order to use the same vocabulary. I didn't have, not ever in my life, a relapse. I didn't have a condition that showed me what's progression. I didn't have any sexual impairment. So they are the best to try to share how are they dealing with the kind of issues. And it's another way to try to break the isolation linked to MS. Using that kind of programs between people with the same condition, they are fostering their networks. So at any time they can use that network to share some knowledge and to share how to reduce the impact of the disease. We have demonstrated that this program is useful to increase the activation of the patient, so they know how to be responsible of their care. They know how to knock at our door, and they know how to engage with all the system. And also, we have Emilio. Emilio was one of the patients that led the kind of sessions, so it was amazing to share his experience managing and leading the program. So I recommend all the attendants to check our library to see the sessions because it was amazing.
Mm-hmm.
Yes, both you and Emilio did an amazing job of talking about how he as a patient interacted with you and how you interacted with him. One of the things that struck me, particularly as we talked about the shared decision-making, we as healthcare providers often enter into decision-making as, quote, the ones with the knowledge that we are to share with our patients. And what was fascinating to me in listening to the speakers who have designed the shared decision-making tools and implemented them in MS is that there was one who surveyed patients about their priorities for decision-making and healthcare providers for their priorities about decision-making. And they took the top 10 priorities from each of those two groups, and absolutely none of them matched.
Yeah.
And I think that was eye-opening to me as a nurse, as a healthcare professional. Well, one of the things that tells me is that I need to use my listening skills. I really need to focus on my patients, not be so concerned about what I have to offer them, but I need to listen to them to hear what they need from me, and then tailor my responses so they can be engaged in the decision-making, because we need to listen to them to be able to identify. And as we all know, patients are so very different. And we brought this up in the session. There are some patients who want no engagement. They just want someone to tell them what to do and how to do it. And we as nurses know that works well for the first couple of weeks, and after that it's not good. So our role really is to help engage them, but in order to engage them, first we must listen. One of the other things that was brought up at the session, not necessarily part of the topics, was the Multiple Sclerosis Nurse Pro, which is a EU-based group as part of the EMSP, which has designed programs for nurses actually worldwide, not just in the EU. But there are 7 modules. Nurses can go on to that site, they can log in, they can register, they can view those modules, they can test out at the end if they choose to. The modules are updated every couple of years in random succession. So it was a good opportunity for nurses who are new to come and learn what are the resources for you, but not only for you who are here at ECTRIMS 2025, but for your colleagues who were not able to attend but would like to have access to some of this information. So I think that was an important part that was discussed at the beginning of session 2.
It's a good way to get a portfolio just supporting to get an MS position. So you need to have some background, and it's an easy way to try to get that knowledge.
Yes.
I do recommend it too.
I think it's interesting you've both mentioned the importance of sessions for this, for people, for nurses who are new in the field. And for something like shared decision making, where generating trust between a nurse and a patient and starting that relationship is so critical, and getting it to that point as quickly as possible so that there isn't a distance that gets created from the first meeting. How important then is it to have these sort of sessions where they can learn from the experiences of people who have already gone through it, worked out things like we need to listen more, which you really only get through having experience in it, but so they can start on the right foot.
I think that one of the things that we get this year about shared decision making is how many websites we could have available for us in order to make our consultations easy for our population. So we have a really low time to discuss sometimes in our consultations all the topic regarding MS. And regarding all the options of treatment. So I think all the nurses need the kind of support to provide our support to our patients and to let them use the kind of resources without time restriction with all their relatives in order to have a second appointment to try to get this shared decision-making process succeed. So to provide this overview about all the tools was absolutely necessary in our sessions. But another thing that we discussed this year in our session is the role of AI. And the median age of diagnosis in our population is 30 years old. So they get birth with an iPad, just knocking and clicking and doing everything. So they are going to use Google Doctor and they are going to check internet, and we need to know what could be the role of AI in the future in the field of MS and in the field of nursing. And we need to share our data to try to train that kind of models in order to get a non-biased one. So we provide an overview about the tools. We provide an overview about what should we do to get a proper way of AI in our consultations. But I think there's a lot of things to do, and this is the proper way and the proper place to try to discuss this in the future. What do you think about that, Amy?
I absolutely agree, Miguel. I think one of the things that can be quite overwhelming to the nurses new to MS is the amount of time that it takes to work with a person who is new to the disease. Mm-hmm. Again, we don't want to dump information on them because it just rolls right off. But I think our session yesterday helped us identify how we as healthcare providers can use AI when it's so good, when it's not so good, but how we can use it, because that generation, both healthcare providers as well as patients, are going to use it. But one of the things we talked about is how to use it and how to use our tools to maximize our time. get information, get questions that we may have that may come up in AI that we hadn't even thought of, to be able to make the most of our in-person visits with our patients and our healthcare providers, because we as healthcare providers are very limited in the amount of time that we can spend with each individual patient and family.
And this is something that it's worrying all the multidisciplinary teams. We have a general session about AI within these ECTRIMS meetings. So I think this is something that we as a whole team need to discuss and try to avoid the bias and the risk also linked to AI. So it's a good opportunity to have AI in the nurses session and also in the general schedule of the meeting.
Yeah. I think we can clearly see that there's been some really positive discussions that are going to shape the way that MS nurses are involved in clinical care moving forward. For both of you, what challenges do you still see as the biggest things facing MS nurses, and that you'd like to see if you were choosing the program for 2026 in MS Toronto? What would you like to be discussed?
It's the best question that we could ever respond. From me, we need to go further about what it's going to provide new technologies to us and how could we maximize the results that we could get from these techniques in order to implement them in our clinics. So that would be maybe one of the topics that I want to discuss in our sessions. And the other one is, okay, we are still supporting our patients to reduce the impact of MS. How the new nurses could be involved in research. How, as a senior ones, could we teach the new ones to be involved in research, but with the aim to get good impact in our population? So for me, these are two topics that I want to discuss in new sessions.
I definitely agree with you, Miguel, in terms of research, but I think we need to take it for nurses beyond research. We need to take it towards how do nurses disseminate that research, publishing issues, presenting issues, where to present, how to present, can be very daunting for a nurse who's never done a presentation or done a poster. How can we disseminate the knowledge that is there that we as nurses are collecting? And the other thing I would like to see, I think, is sessions on the role of the nurse as part of the interdisciplinary team. Many of the nurses are involved in day-to-day management for people, symptom management for people, and how, for example, might we as nurses collaborate with our rehabilitation colleagues to maximize symptom management of something like spasticity or something of that nature. Some very practical kinds of things that the nurses can learn from other members of the healthcare team that they can take back and implement in their own practices as soon as they go home from ECTRIMS.
Well, hopefully we can see some of those things implemented next year, but I want to thank you, Miguel. Thank you, Amy, for taking the time to share your insights on the nurses sessions this year, but also for all of your tireless work helping people living with MS.
Thank you.
Thank you so much.
Thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MS Translate. The ECTRIMS podcast is produced and hosted in collaboration with two key partners: MS Translate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community, and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2025-26 ECTRIMS podcast series is supported by educational grants from Alexion AstraZeneca Rare Diseases, Bristol Myers Squibb, Novartis, Roche, Sanofi, and UCB. Educational grant providers have no input in the podcast content. Do subscribe to the ECTRIMS podcast on all your favourite podcast channels, including Apple and Spotify. Visit the official ECTRIMS website, ectrims.eu, to learn more about this topic and more, and join the conversations on X, LinkedIn, Facebook, and YouTube.